Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, we had a show about a year and a half ago talking about child development and really the subject sort of leaned to the autistic spectrum and the very well-known, world-renowned issues that are dealt with here at the Mailman-Siegel Center of Human Development. So I'm brought the people back, except we have a new person here. Let me introduce to you a preeminent PhD and the Dean of the Mailman-Siegel Center for Human Development, Dr. Ronnie Lederman.
Good morning.
Good to have you.
I'm thrilled to be here.
I'm glad you say it's morning because in most places this is now evening.
There you go.
But it's okay. And we have Roseanne Lesek, Dr. Roseanne Lesek. And Roseanne, if I might call you, or I can call you Doctor, one of the two.
Please, Roseanne.
You have to tell me what all these acronyms are after your name.
Oh, so I'm a clinical psychologist. That's my PhD. I'm also a board certified behavior analyst at a doctoral level.
Right.
So I do a lot of behavioral therapy under that. And then I've also been boarded by the American Board of Professional Psychology in child and adolescent clinical psychology. A lot of letters.
Well, a lot of letters, but very, very important to our viewers. You know, we have a lot of moms and dads and grandmas, grandpas that have grandchildren, nieces, nephews, and they're very confused, really, at least in the comments that come to us relative to what is going on. You know, why all of a sudden are we talking about things that we never talked about when my kids were growing up? But I really think that we're into a period of time when we understand more about the development of a child and that these things are not new to our society. They just understood more at this point in time. And Dr. Lederman, let's tell everybody what goes on at Mailman-Siegel.
Mailman-Siegel is quite a remarkable place on the campus of the university. It's a very interesting conglomeration of collaborative programs. So we have 3 institutes, one, as you mentioned, with autism, children that are diagnosed with autism, an early childhood program, and also a parenting institute. So it's a very comprehensive program that not only provides quality services and clinical programs, educational programs, support programs for families and their children, but also we train professionals in the field so that through the university we're training occupational therapists, speech-language therapists, psychologists, dentists, nursing, pediatrics, education, of course. So we are really a very unique program on this campus and really in the country.
Well, you know, again, I have some very significant interest and I guess, in a sense, intellectual bias as to the work that goes on in your particular center because my grandchildren are graduates of your center. And of course, my son and daughter-in-law are graduates in a mommy and me type of involvement. But I think really what the viewers have been asking about is these problems that are somehow attached to children who don't have the ability to have the kind of intervention or education that we present here at Nova Southeastern University through the Mailman-Siegel Institute.
I agree with that, particularly with very young children. We're seeing more children coming with diagnosis of ADHD, 3-year-olds, 4-year-olds, and it's illogical to some degree, not to dismiss the fact there are some children clearly that have developmental issues, behavioral issues. But children are supposed to be moving and playing and doing, but we're really layering that now with a lot of sit in your seat, do work kind of curriculum that really does not match the quality and uniqueness of early childhood and the beauty of the idea that children are supposed to learn through doing and experiencing. So we want children to get messy and dirty and run and play and learn through all their senses, not to be sat down and made to work, because what happens is when we do that, when we make children sit for long periods of time or do work that's not developmentally appropriate, these children cannot do that. Some children can do that in spite of the fact that they're 3 or 4 or 5. But for those children that appropriately can't, they're labeled, as you said. And that trajectory of the label really sticks with these children and causes a lot of issues.
Yes, it does. Dr. Lisek, otherwise known as Roseman, tell us about your involvement with not only the Autism Institute, but the Unicorn Children's Foundation.
I came on board really to expand the clinical services that Mailman Siegel have to offer, and it's an amazing opportunity to be able to see what the needs are in the community and address those needs in a really amazing facility. So we have 3 separate clinics under the Unicorn Children's Foundation Clinic. One is a developmental assessment clinic, and that's where parents who have some concern about a delay in development, or if there's a question about autism, we do assessments and diagnoses as appropriate. We also let parents know what their child's strengths are. Where is your child doing really well, and how can we capitalize on that? So that's in our developmental assessment clinic. We also have a challenging behavior clinic where children who are really struggling in terms of controlling some of those behavioral pieces, so significant tantruming, aggression towards others, really not listening to anything or directives that they're being given. So we can really give parents support. We do a lot of parent training because, as you know, the parents are the ones who are dealing with this on a daily basis. So we do a lot of parent training, and then one-on-one therapy with the child is appropriate to teach them skills that help them communicate their wants and needs in a more appropriate manner, as opposed to having to resort to behaviors that aren't as helpful or functional for them. And then our third clinic is our feeding disorders clinic, and that's where we're working with kids who are at significant nutritional and medical concern and medical risk because they're not eating an appropriate volume of foods or not eating enough of the foods that are going to give them a spectrum of nutrients that they need to grow and develop. So we have those 3 separate clinics to help kids across those specific needs.
We had some professionals, medical professionals on, neurologists and otherwise, that we were talking about. The program basically was about the autism spectrum. And of course today, just using the word autistic is, I guess, is sort of unfair, and you tell me otherwise, because there are so many elements or grades of the autism spectrum. And I would assume that through the evaluative capabilities of the entities that are part of the Mailman Siegel Institute, particularly with the Unicorn Foundation Clinic, that the various levels of the autistic spectrum are dealt with in different ways.
Absolutely. So every saying goes, if you know one child with autism, you know one child with autism. Every child really has such a unique profile of what their strengths are, and we really do try to identify where those strengths are and what those challenges are. So that's why it really is a spectrum of, and that's why it's in the name autism spectrum disorder, that there is a range of functioning. So you're going to see kids who may be able to speak and communicate their needs, and kids who don't. Kids who are able to have conversation, and kids who can't. Kids who can be in a school setting with some typical peers, and then kids who can't. So there is that spectrum of development, and our goal really is what we do know is that early diagnosis and early support and intervention is going to offer that child the best trajectory possible to really integrate them into society and to be able to be a functioning member with their peers and with their family.
Let's stick on that for a second, and either one of you can get into this. I guess you can say the evaluation of that particular child who, in quotes, we don't know what's wrong, there's a problem, and there's some level of autistic, I guess, evaluation. And just as an observer, and actually the viewers have asked this question, can we condition them to be mainstreamed? In other words, do a lot of them get into the traditional, what we would call child's life and education life?
Some children, and again, it's a spectrum disorder, so for some children, they leave our programs, the Bodwin preschool or the academy program, and easily transition into a kindergarten program with some support perhaps, And for other children, not yet. And it is such a unique spectrum disorder that every child is so different that it's hard to, even when we diagnose a child, it's hard to tell the parent what that will look like in 5-10 years. We know, as Roseanne just mentioned, that the sooner a child's diagnosed, the sooner intervention begins, the better the outcome is. So that's really what we're talking about. And we don't really know which children always could be integrated as you're talking about. But for some children, absolutely, they can be, no question.
Well, now we hear a great deal, Dr. Lederman, otherwise known as Ronnie, about Asperger's. You know, you read it, for some reason, the media, print media, social media and otherwise, talk about, oh, this is a functioning Asperger's. You know, I just read recently about a football player that's, you know, that's a quarterback and is a star and he's an Asperger's autistic spectrum. Tell the folks what that's about.
So actually the term Asperger's is no longer a diagnostic criteria.
Right.
Asperger's was brought under the autism spectrum disorder diagnosis. So at this point, and there, I understand the outcry, some people in the Asperger's community were really upset by that was the community that they really felt connected to and a part of. But at this point, people aren't getting an Asperger's diagnosis. They would fall under that autism spectrum disorder. And there's different levels now of functioning under that, of severity, and different levels of support in that diagnosis. But that's why there's that spectrum of disorder. So there could be people who either have gotten previously a diagnosis of Asperger's or function within that realm, who are really able to be a part of society, who are able to hold jobs, who are able to have friends, who are able to live independently. And that's where I think sometimes there's a misunderstanding of, because someone has a label potentially of autism, that they're not really understanding that there's a really wide spectrum of people who can be very functional and proactive members of society. But it's so important to remember that some of those people who you may meet, who seem pretty typical, pretty normal, may actually still need some support. They still may need some job support or some support in terms of living independently, even though they may present to be rather high functioning. So I think that's an important thing to remember as well.
To add to that, right here on our campus at Nova Southeast University, we have a program specifically for college students who have a diagnosis of autism, because they are easily able to do a lot of the academic work. They do need some extra supports, whether it's organizational skills, support with social skills, support with doing things on time, whatever it might be. We do have a program here called Access Plus that is specifically to support a student entering college to get that extra level, because we know that for every child it's a big transition to go to college. For a child with autism, it's even more so. So Nova Southeastern really stepped up and offers that program right here on campus.
I got a letter from a grandma who was talking to me, who wrote about their grandchild that still isn't talking, is almost 3 years old. But you know, I know my son didn't talk until he was 2 years old and everything, and he's a genius and he owns a big car dealership in North Carolina, and he's wonderful, and et cetera, et cetera. What you know, can you find somebody to talk about it? I said, well, I recommended that she, you know, immediately communicate with the Milman Siegel Center, but I don't know whether they did. But I think that's not atypical to some of the questions that are coming to us.
Right.
So what is that all about?
I think that families are ever more so searching for answers. I think that because of the internet, the past X amount of years, there's information easily accessible. And with that comes a lot of confusion as well. So we get a multitude of calls from parents, some of which are valid in terms of their concerns about their child, even though they may have gone to their own pediatrician who said, watch and wait. Our philosophy is, let's look now. So for those parents that are confused, right, it is, and grandparents as well, of course, it is a challenging time to watch your child that you're anticipating certain milestones to be achieved. and your child or grandchild is not achieving those milestones. So our suggestion is always to speak to a professional, as you suggested this grandparent do, because at the very least, they'll get some information about how to increase language or how to increase social skills. Even without a diagnosis, we really need to step that up as early as we can.
Well, you know, my mind always goes back to the magnificent Marilyn Mickey Siegel,
Yes.
who was the founder and the matriarch of this particular program. And she was sitting in that chair. This was like, maybe 6, 7 years ago. We were doing a program. And she was saying always simplistic things, like, you know, get on the floor, read a book.
That's right.
And, you know, talk to them like they want to talk to you. And yet she was evaluating them and communicating with them at a level in which the child would understand.
That's right. And it's true, we have too many plastic toys with batteries. The fundamental idea of getting on the floor, playing with your child, as you said, reading, playing ball, is critical for your child's development. And what I see way too often are children with iPads on their laps, and restaurants, instead of talking about the food and the colors you see and pointing at letters and talking to the waitress together, what we're seeing is children zeroing in on an iPhone or an iPad, and that's really not a good idea. What Mickey Siegel, my mentor, said, and is so true, do the fundamental things that children love, which is play, and that's how children learn. And through the portal of relationships, of course.
Right. Dr. Lisak, otherwise known as Roseman, tell us about the Unicorn Children's Foundation and what a role they play in collaborating with us at the Bowden School and at the center.
So I'm going to let Dr. Lederman take that because
okay.
I came on just this past summer and she has better institutional history than I do.
Okay, let's have it.
The university was really in the forefront of looking at programs for children with special needs that evolved to mostly children with autism. And the uniqueness of the programs here on campus are noteworthy, as we've spoken about. And through the children that were in Bowden School, which is actually with an agreement through Broward County Schools, we have learned a lot more about the needs of the families with children. And one thing that became highlighted, which we just briefly touched upon, was the issue with who have major feeding issues. These are children, we had a child about 6 weeks ago or so who came to us at 5 years old, who only drank milk, rice milk in a bottle. That was the child's diet for years, and supplemented here and there with a vitamin when the parent could have the child accept that. So this child had been everywhere with no luck, no support, could not find answers to this child's questions. Within 2 weeks in Roseanne's Unicorn Children's Foundation clinic, the feeding program, the child was on 16 foods in 2 weeks after 5 years of struggle. So there are answers. We need to let parents know there are answers to the issues with challenging behaviors we often see, with developmental concerns. And our newest program, this feeding program, can make a huge difference, not only in the quality of a child's life, but in their health, because we know that children have to eat. And when they stop eating due to either medical issues, due to a child getting an NG tube when they're very young and not being able to be transitioned off of it, to a child with autism that has sensory issues and won't accept certain foods and has a very limited diet. We see children all the time. We ask parents, what does your child eat? Chicken nuggets and veggie straws.
We just
That's
had a child who eats only veggie straws and drinks only apple juice. Mm-hmm. So some really significant health concerns that are pretty eminent, and the literature also is really, doctors out there are seeing kids now who are coming in with scurvy or with rickets, some significant diseases that there's no need to have anymore, except for these kids who limit their diet so significantly that they're not getting the spectrum of vitamins and nutrients that they need.
But you know, we're so unique. And you talk about the feeding program. I spoke to Dr. Lederman about this a while back. There really are very few feeding, in quotes, centers in the United States. And with all of the, I don't know what the number is, but you know, it's huge. It's hundreds and hundreds of thousands of children that are in this autism spectrum area. many of which have feeding issues. I'm just wondering why the public isn't aware of it.
I think that there's been I would say in the last 5 years and going forward, there is this understanding that there is a need for these types of programs. That's why I was brought down to help open up one of these types of clinics, and there's not many people who have the expertise in it. But I think it's also important to realize it's not just kids with autism. There's kids who have maybe underlying medical conditions that cause them to not eat understandably. Preemies who were in the NICU who got a feeding tube put in and have been medically cleared to eat and just never learned that skill. Or I've seen children who have had cancer, chemo made everything taste like metal, so they stopped eating. Or undiagnosed allergies that for a long time was causing the child a lot of pain, so they stopped eating. Then were diagnosed with the allergies, but still they didn't trust that it's not going to hurt when they eat again. So I think that there's a lot more understanding of what's going on now and an acknowledgement that, wait a second, it's not okay that a 5-year-old is just drinking Pediasure. Or most kids, I think the appropriate recommendation for a child who might be a little picky is, just wait and see and he'll probably grow out of it. And most kids do, that's great. But for those kids who don't, they really languish. They're really, a few years behind getting some support and some help because the parent has taken that wait and see approach.
I've been sitting here wondering whether I should bring this up, but I'm going to anyway. Because every time we get into this conversation about it, I get all kinds of unusual mail. But one of the perverse values of the conditions of conversation around the issue of vaccinations and issues relative to this is the cause of autism and this is not the cause of autism. I don't want to get into that, but it's interesting how the whole issue has brought to the attention of particularly the American public and the affluent American public to a great extent is the issue of autism.
And that really goes back to the love that parents have for their child, and what they're really looking for is an answer. They want to know why this happened to their child, what can they do to help future children. So all the foundation of what's going on in that conversation is appropriate. Asking appropriate questions. Why did this happen to my child? What can I do for future children? But that's where the divergence then happens of, unfortunately, there is no single solitary answer. What we do know after a lot of research and debunking previous research is that vaccines don't cause autism. And in fact, children who aren't being vaccinated are suffering because of the fact that they're getting mumps or measles or rubella or whooping cough. But we need to be able to find out what that causes, and that's what we're trying to figure out. We know that it's some genetic component, some biological component, and some environmental component, and the interaction of those three pieces. And we're working extremely hard to try to figure out what is it, because everybody wants to know that answer and figure out what to do about it.
And they should be asking those questions. They're good questions to ask. Why, how, what. Those are important things to look at. And as Roseandra said, every parent wants the best for their child. And the road they take to find the answers is very diverse. For some, they're still holding on to that vaccine issue, which we know there's no research to support that. But parents have the right to question. Some parents, they take the children off of all gluten products because they've read that gluten causes a lot of stomach distress, which we know that a lot of children with autism have stomach distress, so they go that route. And we see all different answers to all different questions from families. And we're here at the university to try to give research information to make their choices logistical and supportive for the family with the best possible outcome for their child. It's just that
We're
simple.
down to the last 2 minutes of this show. So I want to thank you very much and welcome to Nova Southeastern University. We're
Thank
glad
you
to
for
have you.
having me.
And we love the Unicorn Children's Foundation. And I want to say, I'm going to let Dr. Liederman tell the folks how to reach the Mailman Siegel Center for Human Development and offer all the compendium of programs, because it doesn't only relate to autism. We sort of focused here on autism, but we're talking about children development.
All children.
So let's have it.
Right, all children from newborn to age just about 6 years old now is our continuum, and even older in our clinical programs. We have such an array of programs for every child, every parent in our community. And we welcome parents to call us. We're opening a new behavioral preschool for those children we talked about that need that extra boost next year. We're having preschool programs, infant toddler programs, parent-child classes, clinic programs, an array of really a wonderful assortment of quality programs. So do call us at 954-262-6918 and get some more information there. And of course, through Nova Southeast University's website, look at the Mailman Siegel Center for Human Development. And we welcome parents, and we're always available to speak with parents as well, and promise to get back to every call we get, because we know that, again, your child is the most important part of your life.
Well, I'm always amazed, because when I go up the street, which is now being redone, and I look over at the Jim and Jen Moran campus, and I see the Mailman Siegel Center and the Bowden Center and whatever, I'm always, it gives me great heart. It gives me great heart to know that this university has dedicated itself to the value structure, which President Hamburg always talks about, but the value structure in itself relates to how do you care about the children. We all talk about it. You hear all the political rhetoric about children of our country are our future of this nation. Well, that's fine, but you know, what's happening here at the Mailman Siegel Institute is really a blueprint for the success of this country and the world. And we want to thank you for your leadership. I want to thank you for joining us.
Thank you.
And I want to tell the folks out there that, once again, I always tell you to take good care of yourself. But in this case, I want you to look into and this is not a commercial, it's just a reality. You asked a lot of questions about children's behavior, about children's development. Well, we've got the answers, because this institute has been around for a long time. So remember, this program is your program. If you have any further questions or you want some answers, there's an email address here and a telephone number. Just give us a call. Tell us what you want to know. We'll try to get you an answer. At least it'll go to Dr. Lederman. But I want you to know, once again, that this program comes to you from Nova Southeast University. And my name is Fred Lippman. Until next time, see you.